NEMT versus ride-sharing, medical transportation rivals, or future partners? For those who don't drive, non-emergency medical transportation isn't just a convenience, it's what makes healthcare possible. Medical transportation allows scores of people across the U.S. to reach their healthcare appointments safely and on time. In recent years, rideshare platforms like Uber Health and Lyft Healthcare have also entered the medical transportation space. This overlap has raised one crucial question: do these services rival each other, or will their coexistence be crucial to satisfy the growing demand for medical transportation in our aging nation? Today, we're exploring NEMT versus rideshare and how they fit into the overall medical transportation arena. If you're finding this helpful, hit that subscribe button and give this video a like. We're helping medical transportation providers navigate the evolving landscape of healthcare transportation. Let's start with how rideshare fits into healthcare. Rideshare services first emerged in the early 2010s as basic app-based transport using personal vehicles. Over time, they evolved to include scheduled rides, business accounts, and fleet options. A few years ago, both Uber and Lyft identified a gap, an increasing number of missed medical appointments. This led to Lyft Healthcare partnering with Medicaid, managed care organizations, and nonprofits as early as 2016. Uber Health launched a platform for hospitals, clinics, and care managers to book rides on behalf of patients in 2018. These services target a specific niche: ambulatory NEMT. Ambulatory patients need a ride but don't require additional assistance, equipment, or medical supervision. Now, rideshare as NEMT versus traditional NEMT, rivalry or partnership? At first glance, both seem to be doing the same thing. However, there are specific differences. What is each best for? Ride-sharing NEMT services are designed for ambulatory passengers who can walk independently and don't require mobility aids or personal assistance. Traditional NEMT providers serve both ambulatory passengers and individuals who use wheelchairs, require stretchers, or need support during pickup and drop-off. Assistance level. Rideshare drivers may be but are not required to be trained on how to assist passengers. Their responsibility essentially ends at the curb. This poses a big challenge for passengers who are elderly, frail, or have cognitive impairment. Traditional medical transportation drivers are trained for this, and assistance is within their job description. They usually provide door-to-door as well as door-through-door assistance, meaning the passenger is assisted right to their door and even inside. Vehicle accessibility. Most rideshare vehicles are sedans that cannot accommodate wheelchairs, especially outside major cities. NEMT fleets are built with accessibility in mind. You can find wheelchair-accessible vehicles, stretcher vans, and lift-equipped vehicles to accommodate a variety of physical needs. Medical transportation vans can also be fully equipped with oxygen mounts, first aid kits, and other essential tools, ensuring passenger safety and comfort. Driver training. Rideshare drivers typically receive only general customer service training. They're not required to be trained in handling medical situations, servicing vulnerable passengers, or acting during medical emergencies. In contrast, NEMT drivers often undergo training in CPR, patient handling, HIPAA compliance, and disability awareness. Scheduling and dispatch. NEMT providers schedule rides through dispatch software with complex compliance features, often integrated with billing workflows. Rideshare services typically offer API-based scheduling platforms for booking, tracking, and managing rides online. This software can be integrated with NEMT platforms for seamless involvement of contractors who specialize in ride-sharing but also offer ambulatory medical transportation. This ease of digital cooperation opens up a great opportunity for these services to coexist and flourish. Benefits and limitations of merging ride-sharing and NEMT services. The demand for medical transportation is rising, but due to Medicaid and Medicare cuts, providers cannot expect noticeable rate increases. The healthcare transportation system needs to find ways to satisfy demand without going bankrupt. Cooperation between non-emergency medical transportation providers and ride-sharing platforms is a promising avenue for a more efficient business model. Top advantages of rideshare as NEMT. First, flexibility and scalability. Rideshare platforms allow real-time or pre-scheduled bookings through digital dashboards, making it easier to manage last-minute needs or overflow capacity. NEMT providers who see a spike in ambulatory requests but don't have enough in-house vehicles can easily outsource these to ride-sharing. Second, cost savings. Rideshares can be more affordable when distance is shorter and the passenger is ambulatory. This frees up fleet vehicles for more lucrative orders requiring transportation of passengers with low mobility or high acuity. Third, better access in urban areas. There are more drivers available in cities. Instead of routing your drivers through congested traffic and accumulating deadhead miles, providers can push requests to rideshare, reducing no-shows and wait times. A passenger who cancels a ride or leaves a complaint about long wait times is not only a lost opportunity, but also a liability. Limitations of rideshare as NEMT. Despite the convenience, ride-sharing medical transportation services come with critical constraints. First, no support for wheelchair or stretcher needs. While some platforms claim to offer wheelchair-accessible options, their availability is extremely limited. Second, lack of driver training. Rideshare drivers aren't typically trained to handle elderly, disabled, or medically vulnerable passengers. There's also no standard protocol for handling patient emergencies. Third, curb-to-curb only. Rideshare services are curb-to-curb medical transportation for patients with limited mobility, cognitive impairments, or vision issues. This becomes a safety concern. Fourth, poor rural coverage. In many rural areas, rideshare simply isn't available. Wait times can be unpredictable, or providers may not accept rural pickups at all, making it unreliable for Medicaid or recurring transport needs. Regulatory and liability considerations. Most state Medicaid agencies and NEMT brokers have strict requirements that rideshare cannot consistently meet. These include verified driver background checks, medical transport insurance coverage, vehicle inspections and compliance documentation, driver training in HIPAA and patient safety, and performance oversight and complaint resolution. Unless the ride-sharing platform can guarantee these requirements are met, outsourcing a medical transportation order may not be possible. Potential liability risks. Medical transportation providers assume liability for their vehicles, drivers, and passengers. However, with rideshare, liability becomes more complex. Who's responsible if a rideshare driver refuses service and a person misses a vital appointment? What happens if a patient falls getting in or out of a non-accessible vehicle? How is protected health information handled during scheduling? All of these questions make rideshare a riskier proposition for brokers and healthcare providers. At least for now, major organizations and brokers post contracts with specific instructions that apply to licensed NEMT providers and fleets that meet regulatory standards and deny eligibility to ride-sharing companies. MCOs are willing to absorb the cost of working through pure NEMT providers due to audit risk, potential payment denial, and to ensure compliance and passenger satisfaction. Ride-sharing and NEMT, coexistence is inevitable and necessary. Ride-sharing isn't a replacement for traditional NEMT. However, ride-sharing has introduced flexibility into healthcare transportation that has been struggling with low reimbursement rates and constantly growing demand. Medical transportation industry experts expect a rise in ride-sharing utilization in ambulatory trips and see it as a tool for traditional providers to improve their bottom line and service reliability. In today's environment, it's crucial to treat ride-sharing as a powerful tool to improve the efficiency of your medical transportation business and never fail passengers or healthcare systems that rely on you. As a provider, understanding distinctions between NEMT versus ride-sharing helps you adapt and scale without compromising service quality. If you're looking to manage your NEMT operations more effectively and seamlessly work with ride-sharing platforms, check out RouteGenie. Our software is built specifically for medical transportation providers. From scheduling and dispatch to driver tracking, billing, and compliance, we help you run a smarter, more connected transportation business. That wraps up our guide to NEMT versus rideshare. The key takeaway? These services aren't rivals, they're partners. Ride-sharing works for ambulatory, short-distance trips, while traditional NEMT handles the complex, accessibility-focused transportation that requires trained drivers and specialized equipment. Use both strategically, and you'll improve efficiency while maintaining the quality care your passengers deserve. Thanks for watching, and if you want more insights on adapting your NEMT operation for the future, make sure you're subscribed. We'll see you in the next one.